Hello, everyone, and thank you for joining Oakland Community Health Network with this training about chronic obstructive pulmonary disease and asthma. I'm Susan Stevens. I'm a nurse case manager at Oakland Community Health Network, and I'm here to teach you about COPD and asthma. The purpose of this video is to help individual organizations determine the level of training needed for their staff, depending on their position and job responsibilities, upward movement in terms of skill competency, and coordinating primary care needs for people who are living with intellectual or developmental disabilities or persons who are severely mentally ill. The learning objectives include learning about COPD and its effects and symptoms, learning about asthma and its effects and symptoms, to discuss who is at high risk for COPD and asthma and discuss common treatments, and also to review some IPOS goals related to both and to review resources available. Chronic obstructive pulmonary disease. COPD is an acronym. C is for chronic, which is lasting longer than 3 months. O for obstructive, causing a blockage. P for pulmonary, which is related to the lungs, and D for disease, a disorder or incorrectly functioning organ, part, structure, or system of the body. What is COPD? It is a group of diseases that cause airflow blockage and breathing-related problems. This includes emphysema and chronic bronchitis. It makes breathing difficult for the 16 million Americans that have it, and there's no cure for COPD, but it really can be treated. Now let's watch a video on COPD.
Understanding chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, or COPD, is a lung disease that makes it difficult to breathe. COPD is a long-term disease that often gets worse over time and is characterized by inflammation and severe limitation of airflow in and out of the lungs. COPD is an umbrella term used to describe a group of breathing conditions, the most common being chronic bronchitis and emphysema. Many people living with COPD may have both emphysema and chronic bronchitis. A few people have both asthma and COPD. Cigarette smoking is the leading cause of COPD. Long-term exposure to secondhand smoke or irritants such as air pollution, dust, or workplace fumes, and biomass exposure such as wood smoke can also contribute to COPD. An uncommon genetic disorder called alpha-1 antitrypsin deficiency is sometimes associated with COPD. Although respiratory infections such as influenza and pneumonia do not cause COPD, they can make people with COPD very sick. Therefore, it is very important to keep these vaccinations up to date. At first, COPD may cause no symptoms or only mild symptoms. As the disease progresses, common symptoms include shortness of breath, wheezing, and chest tightness, especially with exercise, and an ongoing cough, often with a lot of mucus. As COPD symptoms worsen, breathing requires much more energy, and it can get harder to exercise or do routine activities like getting dressed or climbing stairs. This may lead to fatigue, weight loss, and muscle loss. People with COPD can experience a variety of symptoms. Different stages of COPD range from mild to moderate to severe. In normal functioning lungs, when air is inhaled, it travels down the windpipe and into the airways, or bronchial tubes, of the lungs. Inside the lungs, the airways branch out into smaller and smaller tubes called bronchioles that are rich in blood supply. At the end of these tubes are billions of tiny air sacs, called alveoli. Normally, the walls of the airways and air sacs are elastic and flexible in nature. Inhaling causes each air sac to fill with air. Exhaling causes each air sac to deflate. Efficient uptake of air into the lungs provides oxygen to the blood, which is then carried to all parts of the body. In COPD, however, the airways become thick and inflamed, and they produce more mucus than usual. This mucus can clog the airways and makes it hard to breathe. In COPD, the walls of the air sacs in the lungs are damaged and lose their elastic quality. The air sacs get floppy, broken, and lose their shape. As the air spaces get larger, air gets trapped, and there are fewer air sacs to supply oxygen to the blood. Because air is trapped in these air sacs, it is difficult for lungs with COPD to deflate like normal lungs. This trapped air makes it harder to get fresh air into the lungs and makes breathing more difficult. COPD is the third leading cause of death in the United States and affects more than 13.5 million Americans. It is predominantly diagnosed in middle-aged individuals older than 40 years and is present in both women and men. Although COPD is more common in men, more women die from this disease each year than men. The rate of COPD continues to increase worldwide due to smoking and worsening air pollution. While there is no cure for COPD, you can take steps to feel better, stay more active, and slow disease progression. COPD can be managed by consulting early with your healthcare provider, seeking diagnosis and intervention therapies, and adopting lifestyle changes that include quitting smoking, pulmonary rehabilitation, healthy eating and exercise, and maintaining a positive outlook.
Some of the symptoms of COPD are frequent coughing or wheezing, excess phlegm or mucus production, shortness of breath, trouble taking a deep breath. Now, how is COPD diagnosed? A test called a spirometry or a lung function test is used to help diagnose and monitor COPD by measuring how much air you can breathe out in one forced breath. Now, doctors use stages 1 through 4 to describe the severity of COPD. And a GOLD, known as a Global Initiative for Chronic Obstructive Disease System, is used to grade COPD based on symptoms, hospitalizations, and spirometry results. Stage 1 of COPD includes mild COPD, lung function test is equal to or greater than 80%, and some airflow limitation. There's a chronic cough and excessive mucus, and people rarely seek treatment due to not associating their symptoms with being COPD at this time. In stage 2 of COPD, this is considered moderate COPD. There's a lung function test that's showing results of between 50% and 79%, and this can be with or without chronic symptoms. And this stage is when most people seek medical treatment, and the symptoms are more problematic. Stage 3, this is more severe COPD. The lung function test is between 30% and 49%. This can be with or without chronic symptoms, and COPD exacerbation is common and evident. Stage 4 of COPD is very severe. The lung function test is less than 30%. It's also known as end-stage COPD, and it's greatly impaired, and COPD exacerbations are life-threatening. This could also be respiratory failure. Some of the causes of COPD are smoking, which is the #1 cause of COPD, air pollution, occupational exposure, such as intense and prolonged exposure to workplace dust, chemicals, and fumes, and just genetics can make someone more susceptible to developing it. Infectious diseases such as AIDS and tuberculosis, they increase the risk of COPD. Here's some treatments that they have for COPD. It's for people who are smoking. The most important thing would be, as part of the treatment, is to quit smoking and to avoid tobacco smoke or other air pollutants at home and at work, and to ask your doctor about pulmonary rehabilitation, which is a personalized treatment program that can teach COPD management and strategies to improve quality of their lives. There are symptoms such as coughing, wheezing, and these can be treated with medication. In avoiding lung infections, as best you can, lung infections can cause serious problems in people with COPD. Certain vaccines, such as the flu and pneumococcal vaccines, are especially important for people with COPD to prevent these items. And the use of supplemental oxygen. Some people may need to use a portable oxygen tank if their blood oxygen levels are running low. Self-management for COPD. This includes working towards quitting smoking, exercising regularly, eating a healthy diet, avoiding exposure to airway irritants, and following the specific COPD treatment plan by their physician, and calling the doctor right away if their symptoms are getting worse. Next section's on asthma. What is asthma? Now, this is a condition in which the airways, and these are the tubes that carry air in and out of the lungs, they narrow and they swell, causing reversible obstruction. For some people, asthma is a minor nuisance, and for others, it can be a major problem that interferes with daily activities and may lead to life-threatening asthma attack. There's no cure for asthma, but symptoms can be controlled. And now let's watch a video about asthma.
Hello. In this health sketch, we'd like to talk to you about asthma, a common condition that affects the airways and causes episodes of breathing difficulty. Asthma affects around 5% of the global population, and it is becoming more common worldwide. It often begins in childhood, but also affects adults. We don't fully understand what causes asthma, but it seems that both genetics and the surrounding environment are involved. But what exactly is asthma? Asthma affects the airways, the small tubes which transport air in and out of the lungs. Asthma occurs when the airways are more sensitive to certain triggers, so that from time to time they become narrow, inflamed and swollen, and more sticky mucus is produced. All of these changes reduce the flow of air, which leads to some or all of the following symptoms: coughing, breathlessness, tightness across the chest, and wheezing, which is a whistling noise when breathing. Depending on the severity, these symptoms might occur every day or only on occasion. A sudden worsening of symptoms is called an asthma attack, and this can even be fatal if not promptly treated. This is why it's important to see a doctor if you think you might have asthma. Some other conditions may also cause similar breathing problems, but a doctor will be able to diagnose asthma based on your history of symptoms and through breathing tests, which are used to support diagnosis, determine severity, and monitor treatment response over time. Inhalers are the main treatment for asthma, as they deliver medication directly to your airways, helping them to expand. There are two main types of inhalers: preventer inhalers, which you take every day to help prevent symptoms from occurring over the long term, and reliever inhalers, which you use to immediately relieve symptoms as and when needed. Combination inhalers combine both types. A nurse or doctor can show you the right inhaler technique, which is important to make sure the medicine actually reaches the airways. They can also help you decide which type of inhaler device will work best for you. Apart from inhalers, another key step is to avoid the things that trigger your symptoms. These will vary from person to person, but might include cold weather, cigarette smoke, pollution, pollen, dust and mold, animal fur, chemicals and fumes, stress and anxiety, strenuous exercise, and infections like common colds or flu. Some of these triggers are unavoidable, which is why you should always carry a reliever inhaler with you. It's also important to monitor your symptoms over time. If you notice that symptoms are happening more frequently, arrange to see your doctor at the earliest opportunity, as you may need to be stepped up onto higher doses or other medications, including oral tablets. Also, remember that if an asthma attack gets worse and your inhaler doesn't seem to be helping, you must seek immediate medical attention, as stronger medications may need to be given in hospital. While there is no cure for asthma, treatment is usually very effective for controlling symptoms. These symptoms may lessen over time or even disappear for long periods, particularly in people with mild asthma, while in others, symptoms will be more severe and long-lasting. But in all cases, simple steps can make a big difference, such as stopping smoking, identifying and avoiding possible triggers, keeping fit and healthy, taking medication correctly and as prescribed, and keeping a reliever inhaler with you at all times, getting a flu vaccine every year, keeping track of symptoms, and having regular asthma checkups with a nurse or doctor. Through these steps, most people with asthma will be able to manage their condition and lead normal and healthy lives. In this health sketch, we've talked about the common breathing condition, asthma. We've described what happens to the airways, the triggers that bring it on, how it is diagnosed and treated, and how you can stay on top of it. We hope this health sketch has been useful for you and those around you. Health sketch, health for all to see.
Did you know in the US, more than 25 million people have asthma, and about 7 million of these people are children? The Allergy and Asthma Foundation rated Michigan the 4th most challenging state to live in with asthma in 2015. Some of the symptoms of asthma include shortness of breath, wheezing, chest tightness or pain, chronic cough, trouble sleeping due to coughing or wheezing. There's different types of asthma. There's exercise-induced asthma, and this can worsen in hot or cold weather. There's occupational asthma. This is triggered by workplace irritants. And allergy-induced asthma triggered by pollen, mold. And there's children asthma as well. Some of the triggers for asthma include indoor mold, pollen, and outdoor mold, tobacco smoke and smoke from fires, cold air, strong odors and sprays, animal dander, dust mites, cockroaches. Asthma attack. Now, during an asthma attack, your airways swell, they become inflamed and produce extra mucus. And as the muscles around the airways contract, the bronchial tubes narrow. A person may experience difficulty talking, chest tightness, coughing, wheezing, shortness of breath, and feeling tired. And the best way to stop an asthma attack is to recognize the symptoms and treat it as soon as possible with a rescue inhaler. A severe asthma attack may be life-threatening and require emergency medical attention. And symptoms include bluish lips, a slow heart rate, and confusion. Asthma diagnosis. Now, the peak flow assesses airway obstruction by measuring the air out of the lungs while breathing. So the airflow will be lower in asthmatic patients. And spirometry test can be done to confirm the presence of an airway obstruction. And this is similar to the COPD test. The sputum eosinophil test. Now, this counts the eosinophils. This is a type of white blood cells that are found in the sputum, which is a mixture of mucus and saliva, and this helps in the diagnosis of asthma. And an allergy blood test can be done to identify triggers. Here's some treatments for asthma. Now, often an asthma action plan is made by a doctor to help control a person's asthma. And the plan describes daily treatment such as types of medications, when to take them, when to call a doctor or 911, and to learn just the recognized triggers a person has. Following breathing exercises, medication regimen, and doctor instructions is going to help best as a treatment for a person with asthma. And quick relief inhalers or long-acting steroid inhalers on a regular basis will help prevent them. Other medications such as corticosteroids are also used. Something to consider is people with asthma are at risk of developing complications from respiratory infections such as influenza and pneumonia. And it's important for asthma sufferers, especially adults, to get vaccinated annually. Here's a couple goals related to COPD and asthma. First goal, I will follow my asthma treatment plan by attending smoking cessation classes once a week for a month. The other goal is in response to my suspected COPD symptoms, I will schedule an appointment with my primary care provider to discuss my concerns within the next 2 months. A reminder here is just that it's really important for people served to regularly see a primary care physician regarding their mental health, medication management, and physical ailments to promote healthcare integration. Here's a list of some resources. This is just for COPD and asthma. Here's some local resources. My Strength is another resource that people can use, and this is for anyone that works for OSHN or friends or family or anyone that we're serving. It helps improve their self-care and actually has tools and resources for people. There's a link here, so there's a web access to this, and also someone could put it on their smartphone. As a reminder, there is a quiz linked into the video description to test your knowledge on this health video training. If you have any questions and you'd want to contact me, here's my email address and phone number. Thank you for joining.